new remote therapeutic monitoring CPT codes that were introduced in the proposed 2022 Medicare physician fee schedule. On July 13th, the Centers for Medicare and Medicaid Services released its proposed Medicare physician fee schedule for calendar year 2022. In doing so, it recognized 5 new CPT code sets that are indicative and called Remote Therapeutic Monitoring, for short, RTM. Hi, I'm Lauren Souders from NeuroVlog, and today I'm just going to briefly go over the new proposed rule of the 5 new remote therapeutic monitoring codes that are up for public comment currently right now. The new RTM codes in the proposed rule closely resemble the existing remote physiologic monitoring codes, or RPM, and these were established over the last few years with a code that was for setup and education on the use of RTM equipment, 2 device codes, and 2 service codes. However, for the RTM, here's how they are described in the proposed rule. You have CPT code 989X4, which is the Remote Therapeutic Monitoring Treatment Management Services by physician or other qualified healthcare professional. It can be billed one time in the calendar month, and it requires at least 1 interactive communication with the patient and caregiver during that calendar month, and this is to bill the first 20 minutes. If you are going to duplicate this, but it's going to be over 20 minutes, or it's going to be in another additional 20 minutes. For each additional 20 minutes, you can bill the 989X5 code, and that will be listed separately in addition to code for the primary procedure. CPT code 989X1 is the remote therapeutic monitoring of the either respiratory system, status, musculoskeletal system status, therapy adherence, therapy response, but this must include the initial setup and patient education on use of this remote therapeutic equipment that will be transmitting that information. Now, the CPT code 989X2 is going to be the monitoring of this remote information as it directly relates to the respiratory system, and this can be billed once every 30 days. CPT code 989X3, again, remote therapeutic monitoring of X, Y, and Z specifically related to monitor musculoskeletal system, and this can be billed once every 30 days. So these proposed RTM codes are great news for our patients, for our providers, for digital health companies, because previously there were these RPM codes that we were looking at physiologic data only, and it left so many gaps in the healthcare continuum where these RTM codes can begin to hopefully fill those gaps to better provide that continuum of care for our patients. So overall, this is really encouraging news for physical, occupational, and speech therapists, and even other qualified healthcare professionals, where they can bill for their time and services that were rendered in a remote monitoring type of way. I think what is going to be difficult right now, and CMS notes it as well, is just regarding this coding structure. And so they're really putting a stress and importance on stakeholders in this to submit comments to them to ensure that the flexibility of these codes can be applied appropriately and clinically applied appropriately for the benefit of our patients. And so that is something they're looking at in their open comment. The thing about the RTM codes compared to RPM codes, which monitor the physiologic data, the RTM codes do not monitor physiologic data. And so non-physiologic data is not clearly defined by CMS. And so right now it's really to monitor health conditions through, for example, respiratory status, musculoskeletal status, therapy adherence, and therapy response. So this leaves a very broad range for what would fall under this remote patient monitoring kind of umbrella, if you will. Remote therapeutic monitoring codes will require a medical device to access this data, transfer this data, and so what is being asked and considered is that sometimes with these new remote therapeutic monitoring codes, you can monitor self-reported data such as pain levels, therapy or medication adherence, etc. And so in order to have a medical device, can you consider software, a web platform, or an app to be considered a medical device? where they can input some of this self-reported data, and then it can also then be accurately billed as such. So that is something that they are looking at as we speak in this public comment. That is all I have today. I just wanted to get it out there so people can begin to start thinking about these RTM codes and how they might apply to us, and overall how it will benefit our patient population. I will put 2 links in the comments below, and it's very important to read through them. One of them is a very good overview of these codes and really a great understanding. It's a very good resource. And the other one is going to be the Federal Register from CMS that specifically talks about this proposal of these codes, and so you can read that as well. If you have any questions, feel free to reach out, and as always, have a good one.